Perfect. Yeah, thank you very much, Pam. So my name is Chris Reddick. I am a leader on the small business team under GreenShield. So what we've put together here for you today is, as Pam said earlier, we have a new group benefits program that has been designed exclusively for members of CARST, so your Canadian Association of Radon Scientists and Technologists. Like I said earlier, this is not going to be your only opportunity to speak with me. There will be more of those. I'm going to try to keep this to 10 minutes, otherwise I can talk for a long, long time. So I'm going to try to keep this moving along for you guys in respect of everybody's time. But the plans will be available to anybody as of April 1, meaning if you're looking for health plan options, that's the first active start date that will be available for you guys. So just a little bit, the agenda here, just a little bit about the program overview, some of the plan details, very high level, the experience that you get from GreenShield, from an onboarding digital experience, and the support that we're here to offer you guys. If you're not familiar with GreenShield, we have been around for 60 plus years, going back to the 50s. Our head office is in Windsor. We do have offices in all major cities and provinces across Canada, so we're coast to coast. We are one of Canada's only not-for-profit insurance companies. So as of 2025, we've actually given back over $75 million to essentially Canadians that are underserved in the health and dental space. So that's impacted over 1 million Canadians. The options that we have for you guys here. So we're going to I'll show you very shortly, but there are 3 plan designs for you to choose from, all excellent plan options. In order to be in one of these group benefits programs that I'll show you quickly, you do need to have 3 employees and up. Okay, that's what constitutes a group benefits program. Okay, so 3 employees and up. It's digital enrollments. You can do it through your phone or your computer. We just send your employees out emails. We try to make it as paperless and as simple as possible. You get an app for your smartphone, and claims are refunded generally when you're submitting for drugs, etc., dental, within 48 to 72 hours. For anybody that is less than 3 employees, we do have an option there as well. This is called a healthcare spending account. Again, just trying to keep things quick for you here and high level. And if you want an HSA, okay, this allows you to basically, as long as you are incorporated and you're receiving a T4 income, you can set up a healthcare spending account. It is a CRA product. It allows you to run all of your health claims. Okay, that means prescription drugs, dental, vision, massages, physiotherapy through your company. So those claims become a tax deduction to your business. And for you as the employee, you're pulling money out of your company and you don't have to apply those money for health expenses to your T4 income. So it's tax efficient for business owners. So we've got lots of options here available for you, okay, whether it's the insured plans or the HSA component. So depending on, no matter what your size is, we've got options. High level, here are the plan designs, okay? And I have brochures coming out that are being custom done for CARST members as well. Pam will be getting those that can go out. But you can see bronze, silver plans, drug coverages, depending on what you're looking for, anywhere from $2,500 up to $10,000 of prescription drug coverage, paramedical services coverage, vision coverage, dental coverage. You want major dental, you need orthodontic dental, braces, stuff like that. We do have those options available. Once you get in one of these plans, a common question I get asked, when can I start using the coverage? From day one. Okay, so as soon as you're enrolled and you choose one of these plans, you have access to all the coverages that we're looking at here. So you've got a lot of great options. And then it also includes things like travel insurance as well. So anytime you go to province, go overseas, you've got travel coverage included at 60 days per trip, $5 million of emergency services. These are the rates here associated. So everything is preset plans, okay? Preset pricing for the Karst members. If you come to me or my team and you're looking for a proposal and you give us the information that we need, which is basically just some member data, name, date of birth, occupation, gender, stuff like that. Very simple. We can, and you say, Chris, we want to see, those illustrations with pricing unique to our company. My team will provide you a custom proposal and the full total of what it would cost you guys. You can also add in things like life insurance, dependent life coverage, critical illness coverage. These are options that if the company wants to add them, you have access to them. Like I said, we do have some additional support coming for you guys. Okay, so I've got a couple nice brochures that can go out to all the CARST member businesses. Those will be coming very shortly. Pam will get them. We may, if there's newsletter access, we may jump in there. I have a full team of business development managers, again, right across Canada. So depending on, I'm sure a lot of you are in Ontario, but if you have members that are, Quebec, BC, Alberta, we do have dedicated reps that can be there to help service any of those opportunities. We have an inbox set up for you guys as well. And one thing I always like to offer, I'll talk more with Pam about this, but we do occasionally like to just hold quick 15-minute virtual sessions, similar to this, where we just kind of run through the plan designs and details and are here to answer any questions that you guys have. So those are just some additional, support opportunities to look out for in the future that we'll be offering to all members. Again, when it comes to just the onboarding process, we really like to make things as simple as possible. It's really a 100% digital onboarding experience from the time of when we put your proposal together to when we're onboarding the business and we're onboarding the employees. Okay, it's all done either through DocuSigns or just digital enrollments. Okay, through your phone or your laptop. Very simple steps and processes. Um, of course, you get access to our GreenShield Plus app. Okay, it is a one of a kind, very modern platform. Okay, that you get access to. It's essentially a super app now when it comes to group benefits programs. It's been out now for about 2 years, but you're going to have your health card in there. You can see your benefits plan in there. You need to submit a claim. You can take a picture on your phone, submit it through the app, get refunded back, and that typically within about 48 hours. So you've got the app. Really simple stuff to use. And then, of course, we have our dedicated team. Okay, so we have all the infrastructure to help support your plan once we have it up and running. When you do onboard with us, you get an implementation manager that is there to help support the owner and the employees as they're going through their onboarding experience if they have any questions or need any additional support. Once it's through the enrollment process, you get a dedicated account manager. So that account manager is there for the business owner or a potential plan administrator that they may have. Again, if they have any questions around, invoices or claims, or they need to make any changes, they're there, and we have a customer service team as well. Oh, sorry, I should say we're also bilingual, so we've got support in Quebec as well, but I think we're doing a Quebec meeting soon, so we'll get too much into that. But yes, then we have our customer support team and care team as well. So they are, basically 7 days a week and going to, I think like 8 to almost midnight. So, depending on when employees need to reach out to us, whether it be during the workday or after work hours, we've got lots of support. And then here's my contact information as well. Okay, so you got me there, Chris Rennick. There is my email. There is my work, cell number. Okay, so if you have any inquiries, you want to speak with me one-on-one, I'm here. And then we also have our dedicated inbox for CARST members as well. It's just our small business at greenshield.com or greenshield.ca. Okay, that's our generic email address. If you want to reach out to us, one of my team members will reach back to the business person's contact, and we'll take it from there. So very easy, very simple. And yeah, we're here to help you guys and hope you guys are excited and hope we can chat more with you.
Perfect. Thanks so much,
You're
Chris.
welcome.
And so far, we just had one question in
Sure.
the chat, but I think you did answer that partway
Okay.
through. But just do you have availability in Quebec? And so, as you
We
mentioned,
do, we do. That'll be next on the 19th. I think we've got that, Pam, and
yep,
we'll be going through it then. Yes,
yep, for
certainly
sure.
do.
Good. All right. Well, we do have a couple more minutes. I don't know if anybody has any other questions. So feel free to either put up your hand, unmute, or put it in the chat. I'll give a second. But while you're thinking of some questions, I'll just let you know we as CARST walk through this process as for our staff. And so signed up for the benefit package. Just a quick overview. Chris was great walking us through the steps, but we took a look at the package and then needed to fill in some information about all of our staff and provided that to Chris. Um,
Mhm.
it is a mandatory opt-in, so everybody was part of the package
Mhm.
unless they had other insurance. So they were all able to, make that decision and if they had other insurance coverage and those sorts of things.
Yeah, that's a really good point, Pam. And I always will point that stuff out when we're talking. It's just so when you're onboarding a new group, it's typically mandatory that all employees three and up that are working over 20 hours a week participate in the program. Okay. Unless somebody has a spouse with coverage through another carrier elsewhere, in which case they could opt out of the health and dental benefits. The reason why we do that is because you want to have a good mix of both employees that are going to need less coverage while some may need or maybe heavier users. So you just want to have a nice blend and mix of both, and that just really helps keep the overall pricing for the group sustainable over the long term. So, a good call out there.
Yeah, yeah, good. And then even the ones that didn't take the health benefit package still
Mhm.
got the life insurance portion of it. And
Correct.
yeah, so there's
Yeah.
just that.
Yeah, and we have lots of other cool products as well. Like we have mental health support products that could be added on at a group level. We have telemedicine services as well. That's basically instant access to a doctor 24/7. These are really nice platforms that are owned by GreenShield. And if you want to add them in, you'll see them in the app. And when the employee goes into the app, they'll have their benefits plan, but maybe somebody needs to have and wants to needs mental health support. They'll have access to those services within the app. It's all in one place, and it's really just meant to be a nice, easy experience for
Yeah.
the members. Yeah.
Actually, one other benefit I found when I was going and looking into the glasses option was that you also have discounts with some glasses providers. So before even having to make a claim, or already I think there is a few $100s that
Nice.
in
That's awesome.
discounts that was
I'm really,
available
I'm,
there.
yeah, I'm glad to hear that we have lots of different partners out there, and we try to, provide those that discount savings to our members as well. So,
Good, good. All right. I don't know, Erin, have you seen any hands up or any questions that I've missed?
Nope,
okay.
nope, I look
All
good.
right. Yeah. All right. Last chance for questions, but yeah, Chris, I think that was a good overview, and we will share out this recording so people can certainly watch it again. And then also the information. We've also put together a bit of a contact form, as well as you can email Chris directly there. So we'll certainly share that information out, or you can fill in the contact form to get information about the program. And that's ready to go. Pretty much April 1st would kind of be the first date that we're sort of opening up the package. So we just wanted to give people a time to explore it and reach out and get some information
Yeah,
in
our
advance.
plans all start on the first of the month. So if somebody is looking for something for May or June, they'll just reach out to us and we'll guide them through the process and
Yeah,
answer any questions. Here to help.
perfect. Yeah, good. All right. Thanks so much, Chris. Really appreciate all the information and looking forward to being
Yeah.
able to continue to connect as we
Okay.
start this partnership.
Okay, wonderful. I guess I'll drop here then. And thank you very much for your time as well. Much appreciated and look forward to hearing back from anybody that needs any assistance.
Sounds
Thank you.
great. Yeah,
Okay.
thanks.
Bye.
Bye.